Spring allergy season is hitting kids hard this year, with many parents noticing more coughing, congestion, and even wheezing. So here to break down more on the recent spike is Dr. Almira Contractor from Wellspan Community Health. So good morning. Thanks so much for being with us.
Good morning. Thanks for having me.
So yeah, we can feel it out there. I know my kids rubbing their eyes a ton, the coughing, the congestion. So what do you want to look for specifically when it comes to allergies versus a cold this time of year?
It's complicated to know with kids whether it's a cold or allergies because they almost always have some level of snot, right? So we were just talking about
Yep.
that. Yeah.
Yes,
and
they do.
so trying to figure that out sometimes is just recognizing some of the subtle symptoms. Do they have fever? If they have fever, it's not going to be allergies because allergies don't give you fever. But on the same note, if you're noticing that congestion, cough, itchiness, not really looking great, and it's lasting more than a week or two, then I'd start thinking about maybe allergies. That being said, remember that it takes time for kids to develop allergies. So it's not going to be your automatic response for a kiddo that's less than 2.
That's what I was going to ask. So what age range are we starting to really look at? Like, okay, well, my 4-year-old is really getting, the red eyes and the congestion every year around May. So that
Right.
could be a more clear sign that it's.
That is a clear sign. So most kiddos would be after about 2 or 3. It's not that you don't see signs earlier, but what happens is that it takes time for your body to get sensitized and then produce the histamine in your body and have the reaction, the hyperreaction, overreaction to the common allergens. And that can take over a year or 2 of exposures. So it can take time.
And it can be a scary thing because usually what parents become most concerned about is breathing and wheezing. So what should parents notice then?
So at that time, if you're noticing that your child's having trouble breathing, just recognizing is their nose or is it their lungs. So if it's the nose, you can use some natural things like saline. Saline will help clear out the allergens. There are also nasal steroids, and they come in a bottle like this. And so you can use those to help get rid of the inflammation from allergies. But on the same note, if it gets into the lungs and you're hearing them having wheezing symptoms or difficulty breathing, then you should see your medical provider right away.
And something that you may end up coming home with could be an inhaler.
Right.
And, I have a young child who it is very hard to teach them how to use an inhaler. So there are different ways to kind of help that, right? This is a spacer that people can use.
Right. So not that asthma itself is the allergy, but asthma can be triggered by allergies. It's one of the most common reasons that you can have an asthma flare, all of the allergens in the air. And I did bring with me some spacers to show. So a spacer is basically a chamber in which the inhaler will spray the medication, it'll be suspended, and there's a valve that lets the medication into your mouth. So with smaller kiddos, so with babies, they'll usually have a mask, and they can put the mask on the face, and they can just breathe after you've pressed the inhaler. With older kiddos, they'll be able to take a deep breath and then breathe it in. And this means that the medication will actually get where it needs to go, into the lungs. Otherwise, you're losing more than half of the medication in your mouth, in the airway. It's just not going to work.
Even as an adult, sometimes when I've had to take my inhaler, I feel like, am I getting all of this? So we certainly have one of those spacers for our son. And it was the same thing. We talked to the pediatrician about it. They wrote it for a script with us. We got it when we went to go pick up medicine at the pharmacy. So it was very, very simple. But these are great things to keep in mind as allergy season is in full swing. So Dr. Contractor, thanks so much for giving us the latest information.
Most importantly, I just want to remind you, wash your hands, wash the face. Pollen sits in the hair, the eyelashes, the eyebrows, and on the hands. Leave the shoes at the door and change the clothes. That'll help prevent a lot of the allergens.
Oh, yes, and trying to get them out of your house for sure. All right, that's going to do it for Dr. Contractor. Thank you so much. And of course, we have information on fox43.com if you need to make an appointment or have any questions.